Today we are covering patient advocacy, a concept the NCLEX will test using complex scenarios where you are caught between the patient, their family, and the healthcare team. Expect questions that place you in an ethical dilemma. For instance, a competent adult patient with a terminal illness clearly states they do not want a feeding tube. The patient's distraught family insists that you do everything to save them. The exam will present options like request an ethics committee consultation, explain the patient's wishes to the family, follow the family's request, or document the conflict. The key to answering correctly is identifying your primary obligation, which is always to the autonomous patient. Therefore, the best initial action is to gently but firmly explain the patient's documented wishes to the family, reinforcing the patient's right to self-determination. A common exam trap is to choose a passive option like simply documenting, or an option that escalates too quickly, like calling the ethics committee before performing your direct advocacy role with the family. Another typical scenario involves protecting vulnerable populations. Imagine you have a post-operative patient with dementia who cannot speak and is restlessly pulling at their gown. The team might dismiss this as sundowning. The exam is testing your ability to advocate. The correct answer involves investigating for a physical cause, such as pain, hypoxia, or a full bladder. You must act as the patient's voice by assessing for underlying issues instead of accepting a behavioral assumption. This requires you to challenge the team's perspective and push for further assessment. The NCLEX also tests your role in questioning provider orders. If a physician orders a dose of a medication that seems dangerously high for your patient, your duty as an advocate is to protect them from harm. The wrong answers involve blindly administering the drug or simply refusing to give it. The correct sequence of actions is to first verify the order is written correctly, then consult a reliable drug reference, and finally, contact the prescribing provider for clarification, stating your specific concern. If the provider is unresponsive or dismissive, the next step in advocacy is to follow the chain of command, which means contacting your charge nurse or nursing supervisor. A simple way to remember your role is the phrase, "Speak up for safety." This mental shortcut reminds you that your core advocacy function, especially in exam scenarios, is to be the final safety check, whether that means upholding a patient's rights, investigating symptoms in a nonverbal patient, or questioning a potentially harmful order. The exam is designed to see if you will act decisively to protect your patient above all other pressures.